All right, so as you know, massage is an art, correct? Okay, but guess what? There's another art in massage, and it's actually an acronym. It's for Active Release Therapy. See, so A.R.M.T, art. So active release therapy is a fantastic treatment technique for this, okay? So I'm gonna show you, we'll just go step by step through this, righto. So what we're doing is you're getting the person to actively move from a shortened or contracted position to a lengthened position. So you can imagine we're stretching out, we're breaking up any adhesions, fibrous tissues, scar tissue, tight muscles, tight tendons. So you can imagine, so what we're doing is putting ischemic compression, so pressure on there as we get the person to move their arm. So let me take my watch off there. Let me show you. So, all right, so what we're going to be doing, we're going to start working off of this sort of musculotendinous region. There are also ligaments here, the annular ligament that goes around the radial head there. We're going to work on all of these because that can get restricted as well. But we'll get to that. So simply I want you to just start by this. Now, I'm going to do this so you're treating your own. So you get to feel how tender it is, you know, how sore it is, because it will be quite tender. And so when you're working on clients, you're going to get them, you're not going to hold that and then bring it, because that would be passive if you're going to bend it for them. No, it's not called passive release technique, it's active. So active means they do it themselves or you do it yourself. So it's not passive, that is the person doing this. So if you've got a client, you get them to say, okay, just straighten out your arm or turn your hand like that, okay? As you have, so we get these shear forces as we're pressing down, and let's just use this for an example, and then you release, as I'll show you. Because you want to get, so what we're doing, we're not only releasing these tissues and any sort of myofascial, so it's a form of myofascial release. And so what we're doing is releasing, getting better blood flow to the area, really important to help with healing. So we want more blood flow, more nutrients to the area, and that's what we want to do, to get that inflammation going, to start to go from inflammation to then repair mode, okay, and then remodeling, the third stage. So what you want to do, all right, so I'll just roll this up a bit for you. So whatever dominant hand or whatever hand you want, or if you've got tennis elbow, by all means do it on the affected side. So, right, let's go back. So if you're at home, I'm going to keep it up like this so you can see it well for the camera, but you could just, you know, put your elbow on a, you know, what's this called, a cushion, and just do it like that to make it nice and easy for you. You don't want to hold it up like that. And likewise with if you've got a massage client, you have them lying down, you can have them seated. If you're going to have them seated, you can have and put a pillow just the same way, okay? All right, so let's go back and relocate our lateral epicondyle. So straight down here, you can feel that. The other way you can do it is feel like that. Now, again, if you've got a client, by the way, get them to say, look, if anything's, this is going to be a little bit tender in here, a little bit sensitive. Let me know if any pressure is too much. As you work, so you work to a client's comfort zone, you know, you don't want them gritting their teeth ever. So, you know, say, like, it might be a bit sore as we go through here, but just let me know if anything's too much, okay? And do let them know that it, you know, might be a bit of soreness tomorrow, but and if you tell them, you know, that this is what we need to do, we need to actually create a little bit of inflammation to get the body to start healing it again. So they understand the process, which may leave it a bit sore, but it's exactly what we need to do, okay? And there's nothing wrong with what we're doing. Like, as far as, you know, we're not damaging any tissues or anything like that. Okay, so thumb under the hair, okay, middle finger up on the lateral epicondyle. Remember, if you straighten it, you could put your 2 fingers, if you get the condyle, you can feel it makes that gap a lot easier to feel, okay? So, okay, lateral epicondyle and radial head with my index finger. So what you're just doing there is, so put your middle finger now into that gap there, at the joint line, and what you're just going to do, you're going to come up. So remember, you got the radius going along here, so you're going to the joint line, and you're just going to come up on top of that, and then you're going to sink down with your fingers. So coming up, that's on the joint line right there. Okay, just There it is. I can feel it much easier that way. Bring it up. So we're going to come straight up and over. And you're going to use all your fingers. And you'll feel it. It'll be tender. So what you're looking for, if your palpation skills are great, then if you can feel those tight bands of tendinous bands in there, then by all means go for them. You can ask the person, if you're searching around that particularly tender. When I say tender, sore. So is that particularly sensitive or sore? And odds on it's going to be sore. So okay. So what we're going to be doing is we're going to concentrate at the start around around this area. So if here's the lateral epicondyle, we're going to work just above it. So here it is, going up towards that way. Okay, superior, if you like. So there's a lateral epicondyle. Oh, by the way, when you're doing it, just make sure that your shoulders are down, so you're not hunching like this. Otherwise, you're going to have to get my shoulder course. Anyway, let's just move on there. So there it is, lateral epicondyle. If you just come up, remember I told you the longus, extensor carpi radialis longus, comes up and attaches. You can feel that. That'll be tender there. So, but we're going to come back to that. So there's it is. Okay. Now, interestingly enough, in Chinese medicine, this is an acupressure point right at the end of the. So when you bend, right at the end of the crease of the elbow, is large intestine 11. It's a point that we'll put acupuncture pins in for tennis elbow. So you can also locate it. It's virtually the same spot. So you're going to be using. So we come up. So if you go to the end of that crease, oh yeah, you can just sink down. Now we're going to work at deeper levels, but gently to start with. Again, all this should be in person's going, yeah, no, it's tender, but it feels, when someone's pressing on your shoulders, you go, oh yeah, I can feel that. No, it feels good. I'm not sure that this is going to feel as good like that release because it is really sensitive. So just go gently and you'll feel it yourself. So what we're going to do is come up, all right, and what we're going to do is we're going to have your hand like this. So pressure on, okay? Pressure on, and then we're going to go from a supinated position to pronate slowly. Pressure is on. Pressure is on. I might do 1 or 2 repetitions slowly and then lift off. Why are you lifting off? Because you want blood flow. And that's why it's called ischemic compression. It squeezes the blood out, and then you can imagine like squeezing a sponge. That's kind of what we're doing. Not only okay. So the pressure is like squeezing a sponge, and then new blood flow and new nutrients come in, right? At the same time, we're actively, from a shortened position, we're shortening and lengthening. So you can imagine if I've got something, we're putting these, what they call shear forces. So we're forcing these really tight bands and trigger points to be released as we do this, because we're lengthening the muscle with pressure on. So the important aspects are, so this is just turning this way, okay? So let's say you find a spot there, okay? And then you do it. All right, 1, 2, pressure on, release, go to another spot. Now that might be slightly towards me, right? So slightly up more, up on top of that bone even more. Might be slow down, but only about an inch, okay? We're only just doing an inch. So you can come down and you're just working. So we're working all those tendons. So you just work around there. So here is the epicondyle, lateral epicondyle, radial head. So we are really just working where these attachments are and just along those attachments. So really about an inch. So you're going to go up a little higher. And so I'll just do it one to make it quicker. Take the pressure off, move again. New blood flow is going through. Okay, so I can really feel that. Shoulders down. Okay, and just working all around. Okay, here's the lateral epicondyle. If I come up a little bit, same thing. So you're looking for tender areas, tight areas. You can even go on top of the lateral epicondyle, no problems at all. As you feel that, as you work that, and then move on to the next one. Okay, I'm going to give you other techniques for the muscles and this sort of thing, but this is our start point. We're just going to work around there. So you just get used to that. If you get a bit sore, oh, by the way, I'm coming underneath. You can try it going on top. I think the terms exquisitely tender come to mind when we do this. Move, pressure down the whole way. You can also try your thumb. Certainly if you're getting sore, come down through to here, locate your position, come down. So you're searching around this area for tightness, for tenderness, as we're going to break up any adhesions, any fibrotic tissue, tight tendons, any ligaments. So we're going to just work through this. So that's your first thing. It doesn't have to, it can be just a minute or so, as you just, or even less, but you're just going to work around there. And these are incredibly effective techniques. So if you're getting a bit sore, so remember, we're just, and it doesn't matter, but palm up is going to be supinating, so it's going to contract these. But if you can't remember that, don't worry. So do them slowly, do the movements slowly. Oh, I feel that, boy, oh boy. So this is really good. And then move, so pressure the whole time. Oh, you feel that? Whoa. Pressure on. You can do 1 or 2, but no more, because we don't want to keep doing it without. We want the blood flow to come in. So that's why you do like 1 or 2. Remember, if this was your client, you're saying, okay, just palm up, slowly, slowly, palm down. Okay, wait, palm up, palm down, and so on and so forth. Okay, so once you're getting used to that, we go to the next technique.